Good afternoon, Tom Ginn. Own your own health. We're going to be right back. Good afternoon, Tom Ginn, your host for Own Your Own Health. This platform was set up because we have some major problems in our country around health. And my wife and I, we own a wellness center, so I've been exposed to holistic health and alternative ways of healing and health principles. And my association with in and around the wellness center has caused me to want to get practitioners and other people that have solutions to different ways to look at health, taking ownership of your health. We have been conditioned to turn our health over to our doctors. I'm not downplaying doctors. They have a very major role in our life and other elements in there. So just through awareness, do we have an opportunity to start making decisions, owning our own health, making those decisions that are right for us? No one person has all the answers. And so that's the platform. And today's guest, I'm really excited. I met Ava here back in July, and we've had a couple of conversations. I says, we have to have her on Own Your Own Health. So without any further ado, I'm going to bring in Ava Manuel.
Hello, everybody. Thank you so much, Tom, for having me on your show. And I'm so excited to just serve you and serve your audience.
Well, I'm excited to have you here. I know on our brief conversations, you're going to bring some value to the audience. Our whole mission is that if we can just touch one person, make a difference in their life, we've fulfilled our mission in life, I believe.
That's a beautiful goal.
Yeah. Mission. So what I'd like to do is always just start out a little bit about yourself. Where you're from, where you're living now, your family, your profession, avocation, and then we can start diving deeper into your why. Your story.
So all of the above. Thank you. My name is Ava Manuel. I am originally from the Philippines. Came here when I was 28 years old with my 5 kids and started to be a physical therapist. I've been a physical therapist, taking patients from bedbound to walking to thriving in life for over 25 years. And my recent occupation and job is in the hospital. It's one of those things that I said I will never do, because I'm a very relational person. I love building relationships, in people's homes and, the rehab centers, because it's a longer, and in the hospital, it's in and out. So I said, it's something I would never do, but when it's your calling, life makes a way. So my youngest son developed a heart condition where I have to work in a hospital that's top of the nation in cardiac and also have 100% coverage. So that's how I started in the hospital as a hospital physical therapist. And I fell in love with it. I fell in love with, getting patients out of the hospital beds and getting them back home. But that changed a little bit during COVID. That none of us were prepared for that. As physical therapists, we're used to just getting our patients up out of bed after surgery and then getting them back home, ideally the same day. We pride in getting our patients home the same day, the day after, but the sooner we get them home, it fills our heart. But COVID was a different story because, contrary to everything that we know and everything that we've prepared ourselves and educated ourselves in, nothing prepared us for it. Because I would see patients in the beginning when I first evaluate them where they could still walk, and then they slowly decline to a point where I just turn them in bed, and it's so heartbreaking. It's so heart wrenching. So I've been working in COVID wards from the beginning of COVID until I got my second COVID myself in January of this year, and I haven't been able to get back work since. I've just been working on, like recurrent inflammatory conditions. That's just something that I'm navigating. For one, it's very tedious and physical to do hospital physical therapy work, because they really rely on my strength and my ability to hold them up, especially when standing and walking or transferring. And I just don't have that strength to be able to safely handle patients. I mean, if it was a lesser tasking job, I probably could. Because the thing is, my COVID story, and we're gonna get to this because I am here to answer COVID-19 questions. Yes, but before I do that, I'm gonna give it back to Tom for any questions, because I feel like I've gotten ahead of myself.
Well, you're doing fantastic. I love your energy, your excitement. You found I think this is important for people to know. When people move into the health arena, they come from a place. I found they have a strong heart to serve and help people,
Yeah.
and they find their niche. They find their calling, like you have. And I think that's important. But many times we get in that place, but we recognize there's more. And that sounds like where you're at. There's more that you can do just besides lifting people out of a chair, helping them walk, and do all the things that you'd have to do. Um,
Well,
so
Tom, there's always been more in my heart. I started physical therapy in the nowhere places of the Philippines, where we practically walk the unpaved roads, looking for anyone who couldn't walk or anyone who's having a hard time moving. And in the Philippines, especially 20 years ago when I started this, 25 years ago when I started this, they don't know what physical therapy is, and they've never heard of it. Back in the the provinces, and where we do our community service. And so people would ask me, "Are you a faith healer? Are you a witch doctor? Are you a massager?" So like they have they have nothing to compare it with. But so coming from those humble beginnings to going through all of the layers of our healthcare system, being a physical therapist, I've always had so much to share, and I knew I was always going to expound on it. Not bragging, but I've always said so. Two of my certifications are quite uncommon. They're wound care and wound healing, and lymphedema therapy, which is dealing with people who have swelling. And so I always said, if I only could share and the healthcare would listen, it would change the way healthcare looks like, because of the things that I discovered with my innovative brain, coming from the Philippines, where we practically create and make everything. Because, although we've learned in school that you use a bandage, there are no bandages in the province. You pretty much have to cut up socks and use socks, as bandages. So the
wow.
innovative brain plus the certifications that I got between geriatrics, wound care, and lymphedema just really allowed me to be able to see healthcare in a very different, wider perspective. So yeah, there's so much more to share.
Well, I tell you what, that is, different cultures, different parts of the world. We take our healthcare system for granted here in the United States. We are blessed, even
Absolutely.
with the imperfections, but um, working in that environment where you don't even have some of the basics, like you said, bandages. I mean, that's even hard to comprehend, that we don't have that. So, and I always like to ask this question, because you come from a totally different culture, and how you've been in the United States for quite a while. How do people in the Philippines evaluate what health is? I like to hear what their perspective of health is versus maybe Western medicine or Western culture people thinking what health is. How do they look at health? Do they look at the same way we are? As long as I don't have a symptom, I must be healthy? Or are they working proactively? Are they more, what's their idea about health?
That's a very profound question, first of all, because there are 7,100 islands in the Philippines, and the beliefs are so diverse. But where I come from in Manila, which is a city that's really overpopulated. We also kind of have developed into more work, and fast foods, and being in traffic, and just like really being preoccupied. So we weren't proactive with our health, and a lot of our health gets ignored too until something major happens. The other thing too is they view medications as a privilege, because we didn't have a great insurance system when I left 25 years ago. Well, 20 years ago is when I left. I didn't have a great insurance. It's developing now because we have a lot more call centers, American companies that have developed in there. But 20 years ago, we didn't have a great healthcare system. So people have to pay things out of pocket. So if you have to pay things out of pocket to go to the doctor, if you have to pay things out of your pocket to see a physical therapist, to buy your medications, how many of us would not do it, right? So that's kind of like, life is quite short in the Philippines. I always, when I first came here and I look at the diagnosis of people, and I would have like diagnoses that are 2 pages long, all kinds of surgery. I'm like, oh my gosh, like, I, amazing. I'm like, this would like be dead in the Philippines very long ago, But our like you said, our medicine here in America is a gift. Both, having the privilege to turn into Western medicine and holistic medicine, both are just such a gift because both are readily available.
Well, that's good to know, because many times if we've never been outside, experienced different parts of the world, we take it for granted. But you said something. It sounds just like an American or a Western, that we're busy, we're on
Yes.
the run, uh, we're eating fast food, we're eating. We're not eating what I would call food that's really beneficial to us. So we're encountering the same problems because of that lifestyle. And so there's, ultimately in health, there's about 6 foundational things that we need to manage
Mhm.
effectively: is hydration, nutrition, what we eat, and what we take, and the processed food, as we know today, is directly related to things that
Yeah.
creating health issues in our cultures. I put cultures in plural there. And then nutrition, how do you the right supplementation, then exercise, and other elements that is, I call it a lifestyle. Our whole mission is how to wake people up to change their lifestyle, because ultimately we write the prescription for our health, the outcome,
We
based on
do.
our lifestyles, our decisions that we make. And we
Yeah.
think a lot of it is just because it's convenient, it's normal, everybody else is doing it, doesn't mean it's going to be beneficial to you long term in the health. So, and then we are blessed here in the United States, taking it for granted. Everybody has access to a doctor, access to medications or whatever as needed. But not having that in a culture, um, I just want people to be grateful that we have all these
Yeah.
resources, including the alternative methodologies at our hands. So,
Absolutely. Absolutely. A lot of times, I'm very passionate in working with my patients. And I always believe that what people don't understand, they can't value. And what they can't value, they can't take care of. And what they can take care of can get better. So it all comes back to understanding. So I do spend a lot of time helping my patients and supporting my patients to understand their conditions, understand why they would do, what they would do, what I would ask them to do, and how that changes their future. And there's a lot of consumerism, if you call it that, in accumulating more, in wanting more, in getting more, in eating more. But there isn't a lot of noise towards, like really, seeing your future and, making your choices today on what your future would look like. And I am one of those front row seats. I have one of those front row seats experience when people have to give up everything that they've earned in their lifetime to take care of their health right now. And a lot of times it doesn't make sense, but when you're like moving along in life, wanting to accumulate, you don't see that, but I've sat with and cried with patients who have to give up their homes to be able to afford certain medical treatments. And I promise our healthcare does not cover everything. It's funny how a lot of us are very stingy with ourselves, and we say we don't want to spend what's not covered by the insurance. But really, when it comes to our life and our health and our loved ones, insurance does not cover that, especially quality of life. So it's great to like be informed, to like really make the choices right now to spend. There's something that you said, Tom, that for every dollar you spend on your health, you save X amount of dollars for the future. Say that again.
Yeah, basically, in a proactive approach, and spending money could be your exercise, a gymnasium, going to gym, exercise equipment. It could be the nutrition, really evaluating nutrition. All those things are investments in yourself and your health. And
Yeah.
this is what they know: for every dollar you spend, that is a proactive investment that you'll get a benefit or push something off that could you know, uh, creep up in time. So for
Mhm.
every dollar that you spend, let's say you spend $1,000 this year, you're saving $50 to one. So you're saving 50,000 of future expenses, not just doctor bills and all those things that might come about that wouldn't be covered by insurance, but you're also saving what's the value of the quality of life. If you become disabled, what does that do to your family having to take care of you, be a caregiver, and the stress and all those things that come? I see it all the time. They're
Yeah.
taking care of their family members, their parents or whatever. And that is a cost that we can't put a dollar sign on. So we got to get
Absolutely.
away from dollars and cents versus value and quality. It's not how long you live, it's the quality of the life you have that we're here. There's
Yeah,
no guarantees,
absolutely.
right? That I will be here tomorrow or you will be here. Let's make the most of our health today because that's all we have. And if we take care of it today, it's going to impact tomorrow, the next day in a positive way. So
And
it's more than
the question
economics.
I always ask is, what's when people are really faced, sometimes I sit with patients and families who are like making their decisions on whether, it's very, very eye opening to know that at the end of the road, you actually don't have someone waiting there for you to take care of you. Like there's not a Medicare system, or unless people have invested in a very expensive long term insurance, everything's going to come out of your pocket. And so I sit with families and patients, and they ask what their options are, and really the options are either wherever you look, whether it's a in-home care, or whether it's moving to an assisted living facility when a loved one is needing assistance because they couldn't move and they couldn't do things themselves, or a family member giving up their job and taking care of you. It all comes down to it's our cost. It really isn't covered by the insurance. And so the question being is, how much is your independence worth? What's the value of your independence? What's the value of your ability to continue to live your life at the fullest? And you can answer that question and make decisions from there.
Yeah. What's the value in being able to interface and play with your grandkids and be able to run
Absolutely.
around with them? If you can't, that's a value you lost. And that's heartbreaking for
It's
people.
not fun.
No.
It's not
So
fun. Yeah.
so going back to your why. So you right now you're making some transitions now. You're still a physical therapist. You mentioned something about wound healing and other. Tell me about that, because people, especially as they become more sedentary or those type
Yeah.
of things, our ability to heal ourselves actually goes downhill. I've seen a
Yeah.
lot of people in nursing homes or assisted living, those type of things. They get wounds, they get healed, they can't heal. I'm sure that's probably part of what your mission is, right?
Absolutely. So it actually started with one patient. I was managing a rehab facility at that time in Santa Cruz, and I came across a very, very intelligent professor who have 2 doctorate degrees, and she's been in hospital and nursing home the last 2 years with oozing wounds in her legs, and she just goes back and forth from a nursing home rehab facility. It's a nursing and rehab, where she goes from dealing with the wounds in nursing and rehab, and then she goes into cellulitis and sometimes into sepsis and back to the hospital and back into rehab. So over the 2 years, she's lost her home, she's lost everything. She lost her job, of course. She absolutely lost all of her money, and now she's on medical, only being spared $35 a month because everything else is paid for, like her stay in the rehab, her food, her care is being paid for by medical. And so in exchange, they take all of your pensions if she had any. I'm not sure that she had because she was younger. She was on her late 40s. But she's now pretty much stuck in the system with 2 doctorate degrees. And I could understand the frustration. She's very angry. She does not want to participate with physical therapy. Like, walking is not going to help me when my legs are oozing, these wounds are open, and I didn't know what to do. I didn't know what to do. I, as physical therapist, our license comes with being able to debride wounds, and what that means is like being able to take off scabs and dead cells. So we do wound care is part of physical therapy already to begin with, but I didn't know what to do with this woman, and so I together in this at the same time took a wound care certification and a lymphedema certification because I was told that her condition is lymphedema. Her swelling in her legs like elephantiasis. So I took both certifications, and after I finished with both certifications, and in the course of while I was taking it, I was applying it to her. At the end of that, within 3 months, we were able to move her back to an apartment, help her find an apartment, and help her get her income back, out of medical, and have her be able to manage her legs so that they don't open up anymore. So that's how I started in that journey. It was because of a desperation of not knowing what to do. But since then, I fell in love with it because it's an area that's so subserved, underserved. In our country, we have a lot of people who end up opening wounds in their legs because of blood circulation. So lymphedema, managing swelling works together with wound healing, which perfectly beautifully, because I understand how the circulation goes and how to help the wound heals. So, one of the things is I've always wanted to create a course in wound healing and lymphedema together because it's one of the conditions that is so frustrating, so embarrassing. I had a young woman once. She's got a 7-year-old daughter. When I was working in a lymphedema clinic, outpatient lymphedema clinic, it's funny because the wound care center in town were sending patients that have wounds to us when we're a lymphedema clinic because I was the one working with both of them and was really facilitating the healing. I've had wounds who haven't healed for 12 years that I've closed, and have educated people to keep them closed. So I have this young woman who have a 7-year-old, and her legs are just oozing. It's an infected wound, but all of the antibiotics that she's taking isn't cutting it, so she's just oozing, and she's so embarrassed. She brings 2 pairs of extra Vans because in the middle of her taking her son to school, riding the bus, and then going back home, she would have to change her sneakers twice, and then people would smell her in the bus, and so she's so embarrassed, and her son's embarrassed, also with her. And so things like this, and people don't know what to do with it. Like the only thing that we do with Western medicine is antibiotics, and sometimes antibiotics doesn't work just because of how the circulation isn't really getting into where the antibiotics should go. So that's kind of like the gist of it. It's so much fun. I love it. I'm weird. When I was working at the outpatient lymphedema clinic, whenever there's a very, very foul smelling wound in the waiting room, I'm like, that's mine. I'm taking care of that. But I guess we all enjoy the things that we're good at, and so that's one of the things that in the future I'll write a different book for that or create a course for that.
Wonderful. That tells a lot about your heart and your why. And a lot of people do things in life. They do it because it pays a bill. That's
Mhm.
important too. But really finding that thing that look what you did for that woman. Helped her get to a place back, call home, a better quality of life, and that is a blessing that you'll live positive the rest of your life, right? So
Yeah. And
that's
that's I have hundreds of those stories, hundreds of those stories.
oh
And so
wow.
I'm just grateful. I'm like, a lot of people say, getting out of physical therapy to do something else, maybe. And like I'm authoring 2 books right now. And it's not so much to get out of physical therapy, but it is to expound. I always felt like it's a loss to the world that what I know only goes one on one. Like the people that benefit from what I know are the ones in front of me. So what would that look like to be able to share that in a bigger scale and help more people? Because a lot of times, especially with lymphedema and wounds, whenever someone comes in front of me, they're in tears and like, where have you been all my life? Like, I've been like, I've been misunderstood, misdiagnosed, like no one understood what I was going through. And so like to like really be there for those people in a larger scale, and maybe figure out a way on how I could disseminate the information, versus just like doing it one on one. Because like I feel like, you can only do so much one on one.
Well, I love what you're saying, and finding a way to get a message out, or the education, or a product, or whatever it is, because we are limited by how many hours a day, how many people you can serve. And if you have a bigger heart than that, how can we do that? And I think a program like this is another way that let people know
Mhm.
that there's somebody out there that can maybe guide them through a wound issue, or emphysema, the whatever. I'm not going to try to expound on any medical terms here. So, but that's, I think that it's part of your why. How can I
It
serve and
is
help more people?
absolutely.
And
How I got into physical therapy is a funny story. So in the Philippines, mothers know best. Like mothers have the say to what you do and who you're going to be, and that's it. That's why you have a lot of Filipinos who are nurses. you know and that's just the authority of a mother in a Filipino home. And so my mother decided I was going to be a physical therapist. I didn't even know what physical therapist is and what physical therapist does. It's funny because a lot of my patients would ask me, so what, just because they see my heart, they'd say, so what made you take physical therapy and be a physical therapist? And a lot of times people would have, like, a physical therapist would have a dramatic story, like, oh, I saw my grandpa, or I was into an accident, or my dad was something. Like, they would have something that would have a strong correlation with them being a physical therapist. And mine is like, my mother forced me, but it's one of those situations where mother knows best, because I didn't know what it was, but I fell in love with it, fell in love with. And I'm grateful that I get to do the things that I get to do every day. Get patients out from being stuck, where they are, whatever their condition is, whether they're stuck in bed, or they're stuck in a chair, or they're unable to get out of the house, to being able to, live the next level of life. So it's such a fulfilling profession.
yeah. You mentioned your book. You said you got a third one. It sounds like going to be in the making. But let's talk a little bit. COVID hit us a little over 2 years ago, right? So, how did that
Two and a
impact?
half now.
Yeah, we're losing track of time. So it's so so that impacted the level of care, I'm sure, on a one-on-one basis in the institutions.
Absolutely.
And that's heartbreaking in itself, when people need that care, not getting the type of therapy they need for moving forward. And that had to be heartbreaking.
Oh yeah. A lot of times people were asking, when I was just recently interviewed, and I was asked, were the hospitals really were really full? And I'm like, well, in the hospital setting, what full means, staffing. Like, it's not that we have a lot of beds, but there's a staffing ratio that's required, that before we can even get someone out of ER to admit them into the hospital, we have to find another nurse, like calling all nurses, see who else wants to come in, because we've got people in the ER we can't bring up unless we get another, because there's a ratio. There's a ratio by law that we have to be able to care for the patients. We can just, like, bring all of the patients that we couldn't care for. So people were asking, what's that like, and we know that it was just crazy. Like, we were just hit with a perfect storm, between between quarantine, like if a nurse was exposed to a family member who had, who turned positive COVID, or if they were exposed to a patient who turned positive COVID, or if they had COVID themselves, they have to take like a quarantine of 14 days in the beginning, then it was shortened to 10 days. But that means like we're like skeleton, like everyone's being quarantined, and we're barely functioning. We couldn't get people off of ER, and whatever it is that we have, we're overextending ourselves because we couldn't get enough staff. And so it really was, in the physical therapy setting, there isn't a ratio, but what it is we have to see the patients who are more compromised, like someone who the nurses can walk or could get up by themselves, will pass on, but we'll see the ones who really really couldn't move by themselves, who the nurses couldn't move either because of how compromised they are. So it was like very very tasking in terms like when I had my first COVID in January of 2021. I'm like every muscle and joint of my body was given out, like because everyone was heavy. We go from one heavy patient to one heavy patient because we only get to see the ones that are very compromised because we're short staffed. And so it has been a very challenging environment. And so that was, but one of the things I would like to share you this, as challenging as it was, as discouraging as it was, because it's so discouraging when, especially, I was in the ortho neuro department and our nurses are ortho neuro. We're used to like really getting patients well, like almost every day. Our passion is to get people home, like get people home, get them out of here. And to come from that to turning it into a COVID ward and keeping people alive, if you can, was just like really heart-wrenching. What a shift. And I couldn't even describe the change in the atmosphere. But there's one patient that became an inspiration for me. His name is John. And John and his wife got admitted at the same time in the hospital. I saw him the first day of his admission. Well, it's the second day because I'm seeing him after his admission the day before. And finding out, normally it's going to be a physical therapy evaluation only on the first visit, but finding out that his wife is also on the same floor, I took the opportunity to walk him to his wife, pulled 2 large tanks of oxygen, wheelchair following me. We walked to his wife's room, and his wife is much worse than he is. And, when he approached his wife with a full face oxygen mask, she was saying things he couldn't understand through the mask. And he was saying things she couldn't hear through the mask. And he sobbed, just touching his wife. And I was with my N95 with face shield on, just like tears pouring down my eyes, witnessing this. When we got back to the room, John thanked me profusely for allowing him. He said, that's so healing for me to just be able to touch my wife and see my wife and see that she's okay. Well, that was the last time because his wife passed away. And the day after his wife passed away, I'm going to see him for physical therapy again. And I could not fathom how this is going to go. I'm like, this is going to be hard. But on the contrary, I saw John already sitting at the edge of the bed. And with a fierce look, he told me, I'm not going to go down without a fight. I'm going to kick COVID's ass. I'm going to fight. I'm going to kick COVID's ass. And something within me was fired up hearing that. After months, over a year of just discouragement, now I have someone in front of me who wants to fight. And I said, I'm going to arm you. And I created kind of like a, what do you call that? Like a handout where I just, summarize the things that I would do with our patients, from what their condition was in the worst condition to as they get better. And I empowered him. And within 1 week, the challenge with, like you said, being short staffed is we're seeing patients once a day, every other day. And that wasn't enough, but when he was empowered, he was given kind of an understanding, worked with him for 2 days, explaining it, worked with him, demonstrating it. Once he understood it and he was able to implement it every hour, every 2 hours, every waking moment, then he was able to get himself out of where he was, to get back to, out of the hospital, even though he had to go to rehab first, within 1 week. And that became an encouragement. And I said, if people can only understand, if they can only be empowered, then they can get better. And that was the inspiration behind the two books that I'm creating right now. Initially, it was just going to be one book, but then it was getting to be too much, between having to explain the anatomy and physiology in very, very simple illustrated terms that people can understand. Because remember, going back to, if what you don't understand, you can't value. You got to be able to understand what you're doing and what it's doing to your body to be able to value it, and then knowing what steps to take. So those are the two endeavors that I'm working on right now, Tom.
Well, we're going to get to your book in a second. And I just want to say this, that, the gentleman, what was his name? John? And
John,
he
yes, I
walked
call
in,
him John. John is not his real name, but
yeah,
for
just
humor
for the sake
reasons,
of,
we can't just use other, real people names.
yeah. So, and I think that was one of the biggest tragedies of the COVID, is that a lot of people are isolated from their loved ones. And we need that connection. That is an essence of our life and our value. And the fact you were able to get him down there and have that meeting with his wife, and then she passed, but it gave him probably that hope again for himself. Otherwise, if he didn't have that opportunity, who knows? He may have just resigned and said,
Yeah,
"I'm checking out."
yeah.
So that's one of the biggest tragedies of the COVID, is how individuals are isolated from their loved ones.
Well,
And
in a lot more levels than that, because even in the hospital setting, yes, people are dying of COVID, but they're also dying for a lot of other things other than COVID, like not eating and not drinking, and not having family members to, force feed them and, force them to drink. Because when people are short of breath and they have to take their mask off to be able to sip water and to be able to eat, and it's so uncomfortable and it's so scary because it's so hard to not be able to breathe. I've had the most masculine, very strong bodybuilding men chicken out and say it's horrifying to not be able to catch your breath. One woman described it as, I'd rather have 10 childbirths than not be able to breathe, because that inability to catch your breath, is just very scary. And so people choose to not eat and they choose to not drink because they don't want to get short of breath. And that's where organs fail, when people are not being able to receive the things that they need to be able to build themselves back up.
yeah, and yeah, health goes beyond just some things we talked about. Said emotional connection, and that's part of life. And science knows this: is if our thinking goes awry, it affects us at a cellular level, and we can go downhill from there. The
Absolutely.
power of our thinking about our health. And
Hmm.
let's talk about your book. I'm going to bring this up here. Let's see what we got here. There are your books. You'd like to?
Yeah. So the first book is an in-depth illustrated guide to really understanding COVID-19, simply explained. I had an ICU nurse extraordinaire who is also an amazing artist, Tony Forrest, who drew the illustrations in this book. And they're almost like a cross between anime and anatomy. And so they're very original and really explaining what goes on in your cells, when your body fights with the virus, and how our body reacts to it, and once you understand the basics of that, it's almost common sense, like you'll be able to figure out how to help your body heal. The second book is going to be You Got COVID, Now What? It's a physical therapist guide to, we're going to change that because people say I shouldn't be cussing. Your kick-ass fight against COVID-19 using first principles. So it's like teaching you how to think. First principles is like really helping you, ask the questions that would help you come with the answer. So I'm not really telling you what to do, but, really making it easy in a way that here are the different dimensions of your cells from a cellular level where you can get healthier, and what are the options that are available for you for each dimension, for each quadrant. And that's how the book goes by it.
Wonderful. So they ready. When are the books coming out?
So the first book is coming out September 30. It's just how it is with my publisher. That they require certain time for turnaround, but it's September 30, and then the second book is most likely coming out the end of October also.
Okay. And how can they get information on the book? Is that on your website there
It's going
that
to be
we
on the
have?
website. Yes, COVID-19recoverynow.com. And of
Okay.
course, you can email me to avarpt@me.com.
Okay. And so what prompted the books? What was the first book? Is just to give people what resources?
Well, first of all, it was John. John
Okay.
prompted the book, like this, no, getting inspired, getting fired up. That people, when people are equipped with the right information, they can get better. Second, I had COVID myself, in January, and I had navigated, post-COVID symptoms, post-COVID exacerbations and relapses, and looking for answers myself to explain myself because no one could explain me. Like my cardiologist said, your heart, with all of the tests, looks normal. It's kind of like borderline normal, but it's normal. My doctor couldn't explain myself. What it is when I exert myself. When I get exertional, my blood pressure drops, my heart rate goes up. I have a doctor that I interviewed with recently, just over the weekend, who was explaining that it could be a postural orthostatic hypotension. However, it's not postural, it's exertional. It's not when I get up that it changes. It's when I get exertional, like whether I walk half a block or, whether I, do a little too much more than usual. So I actually, one of the things that when we were together in the Can You Really Think and Grow Rich, I was guarding myself a lot because I have moments of I was dizzy and I would just like lean back and hold on to something. But it's something that I don't look like I have post-COVID symptoms and I have post-COVID conditions. But that's kind of like how sneaky it could be. It could, and the only reason I understand it is because I know how I feel, and I understand swelling. I understand when my swelling is setting in, my inflammation starting again, and I'm exacerbating my inflammation, and I know exactly what to do. Otherwise, if I didn't know, what it would look like is I probably would be on inhalers, on breathing treatments, and I would just decrease the amount of work that I'm doing and change a job. Many people have done that through COVID. I have been able to navigate keeping myself up and staying to almost where I was before, except not exertional, because of what I know. That's actually what I'm sharing also in the book, and that's what inspired it.
Well, that's interesting. And in all the things we hear, out there that's put out that information, we're talking about how we contract it and how to prevent all those type of things. And we won't get into whether vaccines are right or wrong or whatever the case is. We're not going to get
Absolutely.
political or anything like that. But a lot of people have come down with COVID, and it put me in that category. Okay. But no one's talking about what are post-COVID symptoms and how to deal with it. Is that what you're addressing?
Yes.
Because then they think, oh, I don't know what people think, so
Well, a lot of times people think that they're just frustrated with themselves. They're frustrated with themselves. They're annoyed. They're like, I have my good friend who has gotten COVID back in July, and he's still coughing it up and on and off right now, and it's just frustrating. It's exhausting. The fatigue, the brain fog that goes with that, and so just understanding what really goes on in your body when you fight with the COVID virus, with the SARS-CoV-2 virus, and giving yourself grace and really taking care of what your body needs are, because our body gives us feedback, whether that's hydration, nutrition, whether that's rest, and to just give yourself grace. Your body just came from a war, probably still going through a war inside your body right now with residual, spike protein still floating around that your body's fighting with. And, your organs are not the same. We lose a lot of, cells during a SARS-CoV-2 infection. One of the illustrations that I made is that you literally could take with the amount of cells in billions that people lose during a COVID infection. You could actually line up 1 million cells per mile and be able to travel to Mars and back. That's how much cells people lose. So whatever that looks like in whichever organs is affected. And one of the other things that people get to understand is, I don't know if some of you heard how our I explained this like a lock and key. So the key is the virus and the lock is the cells that it opens, like what cells it attacks. Have you heard about how the cells that the SARS-CoV-2 attacks is the ACE2 receptor cells?
No, you're talking over my head here. So
Okay, so this is going to be in the book, and just to help people really quickly understand that why COVID is so complex and why the symptoms are so varied and they all come in different shapes and forms, is that the key that is the SARS-CoV-2, which is the virus, opens a lock called ACE2 receptor cells. Now, comparing that to a flu virus, the flu virus attacks pneumocytes. The cells that they attack are pneumocytes, which are in your lungs. So the symptoms are concentrated in your lungs. However, with the SARS-CoV-2, ACE2 receptors is all over your body. It's in your kidneys, it's in your liver, it's in your blood vessels. It's what actually the ACE2 receptors are what enables your blood vessels to constrict, to be able to maintain blood pressure. And it's what, without it, people are going to have very, very high blood pressure. But when your ACE2 receptors are also lessened, decreased, what happens is you have a very lax blood vessels like I do. And what happens is people swell, they end up coughing because their fluid accumulation is just so much higher. They're heavier, they're sluggish, so those are the symptoms that goes with that. And it's all over your body. So what happens with people who get COVID is you never know what organs it's going to hit, because ACE2 receptors are everywhere, all over our bodies. And so people come out with kidney symptoms. Some come out with reproductive symptoms, like erectile dysfunction, or a decrease of the drive to have intimacy or sex. Some people come up with brain fogs because ACE2 receptors are all over our body, and the amount of cells that we lose in a COVID infection is just so vast. So it's so important that once someone has COVID, like, really take care of yourself, because here's what's coming that's scary, Tom, and this is what I wanted to contribute avoiding, is what's coming in the next 2 years is that people are going to start developing chronic conditions, whether that's a liver condition or it's a kidney condition or it's a heart condition or it's a lung condition, not realizing that the reason they're developing that is because a lot of their cells were attacked and they've lost a lot of their cells when they had COVID. And although there's no apparent symptom yet, unless they take initiative to take care of their health so that they can fully recover their cells, what's going to happen is we're going to start seeing chronic conditions develop in the next 2 years. Like my cardiologist said, there's so much that we don't know on what COVID does in the body, but we're going to find out in the next 2 years as more chronic conditions develop.
And what you said is at the two things at the same time. Mm-hmm. Disturbing. Okay. And being disturbed causes me to say, how can I start working proactive if in fact something's going to happen because of the COVID, right?
Yeah.
And I believe, I don't know what the numbers are, but almost everybody has been exposed to COVID one way or another, either had it or right, whatever. So that leads to, that whole approach. What I'm talking about is knowing this information. What do you value? Hey, I don't want to get sick. I want to know what could happen to me, and not be down and done and just wait for it to happen. But what can I be doing today? And that's where that ownership, own your own health, start working proactively, improve your sleep, get your hydration up, change your nutritionals, get more exercise, whatever those things are. I think that's important for people because it's so relevant. COVID's still the number one talk out there, one way or another. But that, my little knowledge, that I know that there's long-term implications, and no one knows what they are. So that's even more imperative that we start working proactively.
Absolutely.
in a
Well,
different
Tom,
way.
once you read my book, you're gonna know what the implications are. It's once you understand from the very basic, the very fundamental, what the virus does, and which is the key, and understanding the lock that it opens and what it opens, it's going to be apparent for you what's coming up. That's, and it's not to scare, but it's to empower people to make the choice to choose their health. Because, here's one thing: you could also choose to not choose your health, but what's going to happen is life's going to choose it for you. And so people end up, in situations where now they have to face it, and now they've got to quit what they couldn't quit for the longest time because they had to. Well, there's a better way to do that, and that's choosing yourself, choosing your health, choosing your life, choosing your independence, choosing quality of life, and enjoying it by taking care of your health.
You just said something there, is enjoying it now. I've come from a space of gratitude. Is we can look at all the past things or the the future things that are not here yet, and just get stuck. But I think if we value this moment, you mentioned it, is what we value determines how we respond and react, right? So value your health today, and what does that look like, feel like? Experience it and say, do I want to maintain this? How can I do that? I'm healthy. I'm 72 years old. Yeah, I got some things that come with age called arthritic knees, but through some other methodology I'm using, that situation is dramatically improved. And that's only through awareness. I value my ability to walk downstairs, which I wasn't able to do as they were so painful, or walking downhill. Today I can. But it's
There's
only
no
through
price
what
to
I
not being in
value.
pain, Tom.
What's that?
There's no price to not being in pain. It is,
Exactly.
yeah, pain is horrible. So just to really be able to get that change in you, where you're being able to do more things with less pain or without pain, that's very, very dramatically good.
Yeah, and how that impacted my wife. She's very active and likes hiking and bicycling and all that, and that my desire is to be on her side, and that's the quality of life. And I think when we talk about health and what you're talking about today is evaluate your health in relationship to everything around you.
Mm-hmm.
And then when you know that, then you make, like you said, I love your quote. I'm going to I'll give you credit for that when I use it every time. Is what you value is how you move forward. So
Yeah.
I'll get that all written down clean. I'm sure it's in your book, right?
Yes, it is.
Yeah. Um, I tell you what, an hour goes in a hurry here, and I love your spirit. I'm glad we connected at that event in Los Angeles. We started a small conversation, and I recognized through that group that we should be talking, and I'm glad we have. My mission is to bring awareness to what's going on out there about people's health, and you brought up some very important information. And hopefully this will, just encourage people to tag and share this
Yes.
out there, because we never know who needs to hear it today or
Yeah.
tomorrow or next week. So
Yeah.
what I like to do is parting thoughts, just sort of what would be your final message you want to leave to anybody that's listening to this program? We had a number of people. I see the ticker going across. We've had a lot of people jumping through, staying, watching. We've only had a couple of people make comments, and I do appreciate Robert for making all your comments. Share this out. But what would be one parting thought that you would want to leave with the audience today?
Well, one of the most practical things that I could say is boost your immune system. There's a lot of talk on whether vaccine or boosters or not, but whether it's vaccines or boosters, they tap into our immune system. It's just empowering your immune system to be able to recognize the virus when the virus comes. However, if your immune system is thin and your immune system is sparse, then you only have so much. So boost your immune system, get get supplements, high dose of vitamin D's, vitamin C, zincs. They have been proven to save you for even, be able to empower your immune system to fight the virus. Even if you got it, you'll be asymptomatic, if anything, very minimal. And it will prevent complications and having complicated, COVID symptoms. That's my parting words.
Wonderful. Well, thank you very much. And I look forward to having you back on again, especially when the book gets out. We can dive deep into some very pointed information so that that the people will be stimulated to get that book. And I just encourage people, they can get that book, find information on your website when that book is
Yes,
coming out. Okay.
absolutely.
So we'll keep that up. Ava, I appreciated today. You brought two great points up to me that going to cause me to look a little bit differently as how I looked at what I value, and number two, what the implications may be long term, and start working today. I think I take it for granted. Hey, I got the little sniffle, sore throat, the cough, tired for a few days. Now I'm back to it, but thinking it's over, maybe it's not over. And I want to make sure that personally I'm doing the right things, taking.
Absolutely.
So you woke me up in a different way, and hopefully other people will hear that as well. So thank you.
Thank you too.
I'm going to put you in the green room here. Don't go away, and we'll wrap up here. Let's own your own health. Ava, I tell you what, she really brought some great points. Her story, her passion and purpose, and caused her to write some books so that we can become better prepared to write our own prescription for our health. I like that term. Write your own prescription. Know what you want in your life and the quality of life, and then work towards that. And it's only through awareness that we can recognize that there are opportunities and solutions to no matter what's going on in our health, whether it be our mental health, whether it be our physical health, and everything in between. So I appreciate what she shared today. Her contact information's there. Be free to reach out to her, get her book, and let's make a difference in the world. Share this out, because we all have the same concerns, especially around what we just talked about, the area of COVID. So please get it out there, share. Let's make a difference in the world. We'll catch you on the next round.